So the delays in recognition and then calling for help associated with the pain and the discomfort of myocardial infarction are extraordinarily variable and colored by the personality who owns the symptoms. We recognize, for example, that those who are older, the ladies as opposed to the gentlemen, people with diabetes, each of these individuals tends to delay longer than the average time to call for help. And that's often a period of some 90 to 120 minutes before the call for help goes out. Variation in this is one that we have tried hard to change and, if you will, draw attention to this, but we don't seem to be very good at modifying human behavior, and that has led to an emphasis on bringing treatment and recognition out into the field because patients don't appear to be coming to the hospital any sooner, despite our best efforts and the work of many around the world. So the typical symptoms in the adult male are often a crushing central chest discomfort, often described as an elephant standing on the chest, and those symptoms may be associated with radiation of the pain or the discomfort to the back, the shoulders, the arms, or the jaw, and may be associated with shortness of breath and sweating. But unfortunately, that symptom complex is not always the case, and so the pain or discomfort may be absent. Patients might present, for example, with loss of consciousness, or simply profound fatigue, or enormous sweating, and a feeling of vague unease. Moreover, the pain may be only in the back. We even have patients who think it's dental pain because it's confined to the jaw and doesn't appear in the chest at all. In women, as opposed to men, there may be some sense of anxiety and distress. The discomfort may be epigastric or in the abdomen, and in many, it's confused as indigestion or heartburn as opposed to symptoms associated with the chest discomfort. So there are a variety of symptom complexes that are associated with it, and it may masquerade as other things.
Once someone's had symptoms that are consistent with a heart attack or myocardial infarction, it's very important that they activate the 911 system. Once they've done that, they really put into effect a process, a train of events that can improve their outcomes. So once the 911 call happens, the expectation is the ambulance arrives within 10 minutes for sure, and most urban centers within 7. The paramedic teams will do an on-scene assessment, clinical history, all done very rapidly, and in appropriate patients obtain an electrocardiogram, an ECG, or a heart tracing. Once that heart tracing is obtained, if it shows evidence of a heart attack, of the kind that we treat with clot-busting drugs or balloon procedures, they can activate your care from the pre-hospital environment, so from right in your house or your office, wherever you've actually had your symptoms. Once that activation occurs, there's options. It may be most appropriate for patients where it's not a clear diagnosis to move them to hospital and clarify things. But in the majority, you can make that diagnosis right there in the field and then deliver reperfusion or methods to open the artery with either clot-busting drugs, so fibrinolytics or clot busters, right in the ambulance in certain centers. Or you can move off to the hospital and go direct to the cath lab, bypassing the emergency department and delivering the care with the balloon procedures as rapidly as possible. There's very clear evidence that we improve outcomes by opening the artery in the setting of STEMI and acute heart attack. There's no debate about that. Fibrinolysis has years of research using drugs to facilitate opening the artery. And in the more recent era, our pharmacoinvasive approaches have backstopped the fibrinolytic, the upfront clot buster, by ensuring an open artery through simple ECG documentation of success of clot buster, and if it doesn't work, moving on to the cath lab, and this pharmacoinvasive strategy basically guarantees best care for individual patients. If you think you're suffering a heart attack, phoning 911 gives the system an opportunity to activate your care, decreasing the delays in treatment, which improves your outcome. So that's one of the most important things. But there's also the important aspects of your safety if you're traveling in a vehicle without appropriate support from the paramedic teams, the safety of others, including your spousal members if they're riding with you, the stress to them if something bad were to happen if they were driving, and also innocent bystanders on the street. And another benefit of activating the 911 pre-hospital system is the fact that the EMS personnel can actually deliver care to treat abnormal heart rhythms or bad things that happen to you in transport.